Deputy President David Mabuza failed to appear before the National Assembly for a second time, citing ill health. The Deputy President's parliamentary councillors denied that the leader of government business is incapacitated. He wrote to Speaker Thandi Modise to tender his apology, as he was meant to give oral replies to questions in a hybrid plenary sitting of Parliament. At the same time, opposition MPs want to know exactly what's wrong with Mabuza.
The Deputy President, in both instances, wrote to the Speaker, and there was no query about questioning whether the presidential medical advice is actually correct or not. The Deputy President wanted to come this week to answer. Actually, he was ready to come and answer questions. Medical advice said he must just wait a bit, and then there was an agreement with the Speaker that there will be a mutually agreed date. Now, it's very funny, Mr. Julius keeps on raising this issue as if the Deputy President doesn't want to answer, even the first time. Must the Deputy President defy medical advice in terms of him so that he can actually deal with the public outcry? We're sitting now with if that happens, what are the consequences for somebody to defy medical advice? The Deputy President is not incapacitated, but was asked to not answer, because when you deal with having to speak for a long time, 3 hours, 4 hours, that actually happens. Now, it's funny, Mr. Julius also wanted to see correspondence between the Speaker and the Office of the Deputy President, which the Speaker correctly rejected. Now, it's very surprising that in the midst of colleagues having passed on, 4 of them, both in the DA, in the ANC and various parties, Mr. Julius can come and make this kind of insensitive statements. The Deputy President is ready to come and answer questions, but he cannot defy his medical team. He talks, he's walking and about, but that does not mean that if the medical team say you must be off, we create an impression that the President is in ICU. He's not in ICU.